Clayton Neville, Sybil Summers, it's your station for breaking news 24/7, 96.3 FM HD2 and 570. You know, Sybil, spending cuts are the hot topic right now, and American doctors have some ideas about how we can harness new technologies like blockchain and AI to really use a scalpel to root out waste, fraud, and abuse in the healthcare system.
Yeah, and Dr. Severence MacLaughlin is a globally recognized expert in artificial intelligence, data science, and blockchain technology, advising Fortune 500 companies. So he knows what he's talking about, and he's joining us now. Good morning, Dr. MacLaughlin.
Good morning, Sybil. Good morning, Clayton. Thank you for having me on.
Yeah, so first of all, what type of waste are we dealing with in the health profession? Like, what sticks out in your mind, if anything?
Yeah, I mean, so you're looking right now into the Medicare and Medicaid are the biggest areas where there's waste because it's government funded versus privately funded. You know, private companies look at their bottom line. So when you look at Medicare and Medicaid, that's about a $1.4 trillion spend for the federal government. In Texas is about $57 billion. And, you know, there's all types of fraud, waste, and abuse. You know, the attorney general in your state, Paxton, you know, just won a case, $40 million from Molina. That was basically Molina saying, hey, we're going to go look at your patients and make sure they're healthy for their checkup, and they never did it. And then they tried to hide it. But there's also fraud, waste, and abuse where doctors are upcoding and trying to get a little bit more money out of the government and things of that nature. So the federal government thinks there's about 50 to 100 billion in fraud that they can scoop out, if you will, sir.
Yeah. Now, technology can help in this process too, right? Though, so it can hurt, I guess, and help in a sense. How does it help?
So I would say I don't think there's a hurt here, and I don't think your listenership should be afraid. I think we thank God for the president and DOJ for looking at this. You know, just because you cut funding doesn't mean that things are going to get worse.
True.
I believe this is going to make things better, and it's going to force the government and the state governments to hold these insurance companies accountable. Now, for instance, the technology that we have, you know, we're looking at every single one of our patients 365 days, 24 hours a day, and we can tell you if they're at risk. Do they have their appointment? Do they not have their appointment? And so the Molina issue would never have happened. Another example, if I'd give you, is, you know, dialysis patients, right, is mostly funded by the state and federal governments. In the state of Texas, if they've implemented technology sort of like ours, they'd be saving about $250 million per annum for about 8,000 patients.
Talking to Dr. Severence MacLaughlin about all of the budget cuts, especially in the health profession. And I'm wondering how AI is going to play a factor into it.
Yeah, because I think it's going to be the tool that's needed to be there to, one, process all the information, right? So, you know, two-thirds, you know, there's about 80 million people on, I think, on Medicaid, another further 40 million on Medicare. So you can imagine the number of documents and numbers that are there for all those people. So to be able to go through there and give a hyper-personalized down to the individual patient, you need a machine. So by being able to predict if someone's going to get sicker in the future, we can avoid hospitalizations. So another example, if we can predict a hospitalization, on average, we can save about $12,500 per patient. And what we're seeing in the Tyler and Troop area of Texas is we can decrease hospitalizations by about 27% within 90 days. Yeah.
Yeah. And that's certainly useful in using that scalpel to root out that waste. So it all kind of goes in full circle there. Thank you so much for explaining that to us. Dr. MacLaughlin, Severence MacLaughlin, appreciate your time.
Thank you, sir.
All right, Doctor, thanks. 746 at DFW's Morning News. Coming up at 7:50 this morning, we're going to talk more about the stabbing death in